Hi there, I'm Dr. Zimri, and welcome to the 2 Minute Medic Talk. And today's topic, we're going to talk about malaria. So let's start the clock. Now, malaria is a life-threatening infection usually caused by the Plasmodium parasite. Now, there are 5 different types of Plasmodium that infects humans, with P. falciparum being the deadliest. Malaria is common in places like sub-Saharan Africa, Asia, South America, and even the Middle East. So if you're traveling to tropical or subtropical destinations, then malaria is something that you should be thinking about. Common symptoms of malaria are things like headaches, fevers, sweats, chills, and even diarrhea and vomiting. Now, at the time of delayed presentation or the severe end spectrum of disease, you may then even develop kidney failure, coma, and even death. Now, although malaria has a low mortality rate in the UK of about 0.4% on average, it usually typically affects the younger population, so this mortality does carry significance. Now, it's important to know, even if you are infected with the parasite, you may not present with symptoms until weeks or even months, and even in certain species, a year later. The sooner we start treatment, the better your outcomes are, and there are some good available treatments, but prevention is actually better than cure. So it's important you have your insecticide treated nets, your insect repellents, your pre-arranged travel health nurse reviews, which may give you the prophylactic antibiotics to prevent these diseases from occurring, and also ensuring that you're avoiding standing water when mosquitoes love to breed. There are even some vaccines coming out in certain countries, which is very exciting to hear about. And depending on where you travel to, it will depend on what type of antimalarial will be more suitable for you to take. Some examples of antimalarial tablets are things like atovaquone, proguanil, doxycycline, and chloroquine. But chloroquine is used often less now because of its high resistance rates, but it's still suitable in certain malaria zones. So please ensure that you put those preventatives in place to reduce your risk of contracting things like malaria. But remember, these are preventative tools, but they're not 100% effective. And if you're worried that you've contracted malaria, an urgent medical review is advised. I hope that helps.